Good afternoon, everyone. We are Group 4. We have three members. First is me, Hoa, Charles, and Lotions. Today, we like to present a disease named congenital heart disease. About the definitions, the congenital heart disease is called when something disrupts the normal development of the heart. Mostly it occurs during the first 6 weeks of pregnancy, and until now, no obvious cause is identified in most cases. So as I said before, we don't know what causes the congenital heart disease, but we know a number of things that increase the chance of a child having this disease. First of all, is a genetic conditions. A baby inherited from one of both parents can cause congenital heart disease. For example, Down syndrome is the most widely known genetic condition that can cause this disease. Children with Down syndrome are born with a range of disability as a result of the genetic abnormality. In many cases, this is a type of sexual defect. Alcohol, the famous disease named Focal alcohol syndrome will be occurred if a pregnant woman drinks too much alcohol during the pregnancy, and this will affect baby directly and can be poisonous. The medicines are also dangerous for baby if pregnant women don't use it in the right way. Some medicines lead to an increased risk of a baby being born with a congenital heart disease, and certain anti-seizure medicine, certain and medicine or ibuprofen. Next is virus such as Ebola, which is an infectious condition which, which severely affects an unborn baby if a mother develops a rubella infection during the first 8 to 10 weeks of pregnancy, and it can cause multi-birth defects, and congenital heart disease is one of them. The last thing is organic solvents like paints, nail polish, glue. This is because the products are chemicals which is not good for pregnant women. So that's all my presentations, and I will pass to Charles, and he will introduce to you some symptoms of the disease.
Common signs and symptoms of heart failure. Heart failure will make you feel tired and leg weakness when you are active. When your heart does not pump enough oxygen-rich blood to major organ and muscle, you become tired and your legs may feel weak. Furthermore, heart failure will make swelling in your ankles, leg, and abdomen. When your kidney does not filter enough blood, your body holds onto extra fluid and water. This extra fluid in your body causes swelling, edema, and weight gains. Need to urinate while resting at night. Gravity causes more blood flow to kidney when you are lying down, so your kidney make more urine and you have the need to urinate. Furthermore, heart failure will also make you dizziness, confusion, difficulty concentrating, and fainting. You may have this symptom because your heart isn't pumping enough oxygen-rich blood to the brain. Rapid or irregular heartbeats, or we can call it as palpitation. When your heart muscle does not pump with enough force, your heart may beat faster to try to get enough oxygen-rich blood to major organs and muscle. You may also have an irregular heartbeat if your heart is larger than normal. This caused after a heart attack or due to abnormal levels of potassium in your blood. Lastly, heart failure will cause a dry hacking cough. A cough caused by heart failure is more likely to happen when you are lying flat and have extra fluid in your lungs.
Thank you, Jas. Now I'm gonna talk about the types of congenital heart defects. The first one, hole in the heart, which is septal defect. It means that you are born with a hole in the wall or septum that separates the left and right sides of our heart. The hole lets blood from the two sides mix together. Secondly, we have atrial septal defect, in short form ASD. ASD is a hole in the wall between the upper chambers or the right and left atria of our heart, which lets blood from the left atrium mix with blood in the right atrium. The third one is ventricular septal defect, in short form VSD. VSD is a hole in the part of your septum that separates your heart's lower chambers or ventricles. If you have a VSD, blood gets pumped back to your lungs instead of to your body. On to the next one. Complete atrioventricular canal defect, CAVC. This is the most serious septal defect. It is when you have a hole in your heart that affects all four chambers. A CAVC prevents oxygen-rich blood from going to the right places in your body. Your doctor can repair it with patches, but some people need more than one surgery to treat it. 5. Valve defects. Valves control the flow of blood through our heart's ventricles and arteries, and some minor heart defects can involve the valve, including stenosis. When our valves become narrow or stiff and won't open or allow blood to pass easily. So this is the presentation of our group 4. Thank you.